Hello and welcome. Today we're diving into a condition called Detrusor-sphincter dyssynergia, or DSD. It's a mouthful, but understanding it can be crucial for anyone experiencing bladder control issues. We'll explore what causes it, how it affects the body, and what can be done to manage it. So, what causes this dysfunction? Detrusor-sphincter dyssynergia is almost always caused by neurological conditions that disrupt the communication between the brain and the bladder. These conditions include spinal cord injuries, multiple sclerosis, stroke, cerebral palsy, spina bifida, and other neurological disorders. The underlying problem is damage to the nerves that control bladder function, leading to a breakdown in the coordinated action of the bladder muscle and the urinary sphincter. To understand DSD, let's talk about the normal urinary process. When your bladder fills, it signals your brain. Your brain then tells the bladder muscle, the detrusor, to contract and the urinary sphincter, the valve that controls urine flow, to relax. In DSD, this coordinated action is lost. The detrusor muscle contracts to empty the bladder, but instead of relaxing, the sphincter contracts at the same time or remains closed. This creates a blockage, increasing pressure within the bladder and potentially damaging the kidneys. Think of it like trying to push water through a closed faucet. The pressure builds and can cause problems upstream. Detrusor-sphincter dyssynergia is primarily a condition affecting individuals with pre-existing neurological conditions. Therefore, its prevalence mirrors the prevalence of these underlying neurological disorders. Spinal cord injuries are a significant contributor, and the occurrence of DSD is quite high among individuals with such injuries. Exact numbers are difficult to pinpoint, as DSD often goes undiagnosed or is underreported, but it's a significant consideration in the management of neurogenic bladder dysfunction. The signs and symptoms of DSD can vary, but some common indicators include difficulty initiating urination, a weak or intermittent urine stream, feeling like you can't completely empty your bladder, frequent urinary tract infections, urinary incontinence, both an urge and overflow incontinence, and in more severe cases, kidney damage or even kidney failure. Some individuals may also experience abdominal discomfort or pain due to the increased pressure in the bladder. Diagnosing DSD typically involves a comprehensive evaluation. This often starts with a detailed medical history and physical examination, followed by a series of diagnostic tests. Aerodynamic studies are crucial, specifically cystometry and electromyography (EMG). Cystometry measures the pressure within the bladder during filling and emptying, while EMG assesses the electrical activity of the sphincter muscles. These tests help to determine if the detrusor and sphincter are coordinating properly. Other tests may include a post-void residual volume measurement to see how well the bladder empties, and imaging studies like ultrasound or cystoscopy to evaluate the bladder and urethra. While Detrusor-sphincter dyssynergia itself isn't categorized into distinct types, it can vary in severity and the degree to which the sphincter fails to relax. The presentation and management strategies depend on the specific underlying neurological condition and the overall impact on bladder function. The primary goals of treatment are to improve bladder emptying, reduce bladder pressure, prevent urinary tract infections, and protect kidney function. Management strategies often involve a combination of approaches. Intermittent catheterization is a common method to empty the bladder regularly. Medications such as alpha blockers can help relax the sphincter muscles. Botulinum toxin and Botox injections into the sphincter can also provide temporary relief. In some cases, surgery may be necessary to create an alternative pathway for urine drainage or to address structural issues. Regular follow-up with a urologist is essential to monitor bladder and kidney health. Since DSD is typically secondary to neurological conditions, primary prevention isn't usually possible. However, prompt and effective management of the underlying neurological disorder can potentially minimize the risk or severity of DSD. Regular monitoring of bladder function is crucial for individuals at risk, allowing for early detection and intervention. The prognosis for individuals with DSD varies depending on the severity of the condition, the underlying neurological disorder, and the effectiveness of treatment. With proper management, many individuals can maintain good bladder and kidney health and enjoy a reasonable quality of life. Ongoing research focuses on developing more effective medications and surgical techniques to improve bladder function and reduce the long-term complications of DSD. Advancements in neuromodulation techniques are also being explored as potential treatment options. As our understanding of the condition grows, so too do the possibilities for better management and improved outcomes.